Wellness and Spa is a medical wellness, weight loss, and skin boutique focusing on helping Mid-Southerners look and feel their best, as well as provide valuable education in all aspects of skincare, weight loss, from wellness visits for the common cold to spray tans and everything in between. Belle Wellness and Spa is your one-stop shop to feeling better and looking better than ever before. Owner and nurse practitioner, our friend Renee Pinlack, joins us to tell us more. Good morning.
Good morning. Thank you.
Yeah, so glad you're here. Tell us what we're talking about today.
We are talking about bioidentical hormone therapy.
What is that?
It's actually replacing hormones when they are low or gone. So one of the things that we're going to talk about today is the use of a pellet placement for hormone therapy. It's actually placed underneath the skin.
Oh, okay.
And it replaces your estrogen and your testosterone. And we use bioidentical, which is the closest molecular form to your own body, so that your body accepts it a lot easier.
Okay, and this is different for both men and women.
Different from men and women. Both men and women need those key hormones, your progesterone, your estrogen, your testosterone. Of course, men typically have more testosterone or need more testosterone than women do, but women across the board, as they reach perimenopausal and menopausal age, and that can be anywhere from 25 to 55, those people need that replacement to feel normal again.
Right.
And 99% of the people that do use a bioidentical hormone do not need antidepressants. And a lot of anxiety goes undiagnosed where the client needs hormone replacement instead of an anxiety medication.
So what are some of the signs, the symptoms that it may be something that is going undiagnosed?
So on the screen we talk about menopause and andropause, and that's for both men and women. And a lot of times women will start to have hot flashes, they'll have mood swings, they'll have those symptoms, and even they'll have more anxiety than they're used to having. Men will have short temper, where they typically were more even-keeled. They will not sleep as well. So the benefit of using a hormone replacement in both men and women are going to be heart health, bone density, anxiety relief, and sleep relief, and a multitude of other things.
So by inserting, so you're saying you're putting this under the skin, so you're not having to take handfuls of pills then with it?
Correct. So with the pellet, it's about the size of a Tic Tac.
Okay.
It's placed directly underneath the skin, and it allows the body to take that hormone replacement in an even dose.
Gotcha.
So that you do not have the spikes and the peaks and the valleys that you can sometimes have with hormone injections.
Oh, okay.
Men and women that are going through having testosterone injections for replacement of testosterone can most definitely switch to a pellet. Definitely with a cream or a patch. Sometimes you have an unregulated amount, and so by using a pellet you have an even dose.
And it's good for people like me who always forget to take their pills anyway.
Exactly. That way you don't have to worry about not forgetting to take it.
So is there anyone that this is maybe someone's a better candidate versus someone who maybe is just curious and wanting to know about it?
Well, they can come and we can talk to them and we can do their lab values, because that's the first thing we need to do is assess where they are, assess their symptoms, and then do lab values before we can make a decision if they are a candidate or not. But for people that are going through the changes and they're not really sure what's going on, it's a great time to kind of reach out. So whether that's a male who is not sleeping as well as he used to, or he has fatigue, or even from a female standpoint who has already maybe started to have a hot flash, or even before then, just losing energy and having more anxiety.
Gotcha. Okay, so where do we get the information? When can we come see you?
You can come see me Tuesday through Friday.
Okay.
We're at 3086 Poplar Avenue, and we'll be happy to set up a consultation, a hormone consultation, to see if pellet placement is the best treatment for you.
Just a quick question, is it something you feel instantly, or does it take some time to kind of work in?
That's a great question. So we take, it takes about an hour to do the implant, and it takes up to 2 to 3 weeks before you start to really feel your best. Then we reevaluate your labs in 4 weeks to make sure that your optimal dose and the blood level is reached for your optimal dosing.
Well, this sounds like something maybe that if you're at home, you're listening, you hear some of this in yourself or maybe in your husband or your loved one, maybe something to check out. Again, De La Belle Wellness and Spa. You can find out the information on your screen, delabelle.net. You can always visit them at 3086 Poplar Avenue. All right, well, coming up, get your most impressive dress clothes ready because we're helping you land a job this summer. We'll show you just how after the break.